Hey guys, it's Leah Buckles from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and do a little chat about a news article that I read recently on military.com. And I'm going to share it with you. I'm going to read some excerpts from it shortly, but it's about compensation and pension exams and CMP examiners. So I hear a lot from veterans quite frequently about their experiences that they have at CMP exams. Okay. So we've done tons of videos on what to expect at a CMP exam. And if you haven't seen those, check them out. Especially if you have a specific one coming up, you might be able to get a better understanding of what might transpire while you're there. So your CMP examiner is generally going to be, depending on what the condition is, it's going to be somebody that has some type of degree in that field, right? So if it's a mental health exam, you might see a psychologist or a psychiatrist, okay? If it's a hearing exam, you might see an audiologist, or, if you're going for an eye exam, you might see an ophthalmologist or an optometrist. For medical exams, just general medical exams, asthma, knee pain, back pain, sleep apnea, whatever, you're likely going to see any variety of physician, right? So it could be a family practice doctor or an internal medicine doctor. It could be an OBGYN. You could see a PA. A physician assistant. You can see a nurse practitioner. And sometimes people get a little salty about that. And I want to sort of give my 2 cents on sort of both sides of the coin, okay? So if you're going for an orthopedic examination for your knee, for example, it's within the scope of practice of pretty much any type of medical doctor, right? Whether it's a gynecologist, a ER physician, an orthopedic surgeon, to do a knee evaluation. They're not asking for knee surgery in that visit. So to do range of motion of a knee, it's well within the scope of someone's training as a medical doctor to do that, regardless of what they've specialized in. Okay. Now, if they haven't done a knee exam in 50 years, I mean, that's a whole different story. But it's really not that difficult for a trained, licensed medical professional to do a basic knee exam. Okay. That's why a lot of times physician assistants do them, nurse practitioners do them, etc. Okay. So that's my 2 cents on that. Now, when it comes to the exam itself, I hear a lot of veterans complain that, they were in and out of the exam in 2 minutes and that they didn't get any questions asked of them. I've heard tons of times that goniometry wasn't used or joint range of motion measurement for the joint, things like that. There's a set specific things that are supposed to be done for each exam, depending on what it is. Like I said, if you want to check out some of my videos, they may be helpful for you to understand what to expect in some of those. Do you have recourse? Well, that's a really great question. If you feel like you got a bad exam, the best thing that you can do is follow up with an accredited legal professional that can give you advice on that. So a VSO, an accredited claims agent, an attorney, those are the types of legal professionals that can advise you on your claim and how to handle and navigate the system. Okay. If you don't know how to find one, I have another great video on that where you can skip on over to va.gov, and there's a search tool where you can look in your area. You don't necessarily have to use a legal professional in your area. You can use one, nationwide, but there's a good search tool that you can look for somebody that's accredited by the Office of General Counsel to help you sort of navigate the claims process. Okay. So let's pull up this article, and I'm going to sort of go over some of it with you because it's quite interesting. It's Elizabeth Warren. She is a prominent Democratic senator. This article was published on April 24th, and it is on military.com. Reports of mediocre disability exams by VA contractor prompt senators demand for answers. And you know what? I'm going to go ahead and just share screen with you guys so you can see it as well. Okay, here we go. So reports of mediocre disability exams by VA contractors prompt senators demands for answers. So essentially, Elizabeth Warren got a whole bunch of complaints about privatized disability benefit exams recently, and she wrote a letter to VA Secretary Dennis McDonough, and she pushed for answers by May 14th to an array of questions about VA compensation and pension exams done by private contractors. In light of multiple complaints she said she received about the quality of exams, both in her home state and across the country. For example, constituents have reported to my office that this is a quote from her. They have reported to our office that contract examiners failed to review service treatment records of veterans prior to their appointments, shredded medical questionnaires instead of adding them to medical files as evidence because, quotation, VA policy doesn't allow examiners to add anything to veterans' medical records. She wrote in this letter that apparently military.com obtained before public release. They have indicated that contractors directed military veterans to meet them for exams outside of medical facilities, including co-working offices, broom closets, and hotel rooms. I don't know the legitimacy of that, y'all, but I'm just reading you. You guys can see it here on military.com yourself. Asked for comment on the letter, a VA spokesperson told military.com that the department appreciated Warren's outreach and will respond to her directly. The department also stressed that it is processing benefit claims at a record rate and that more veterans are receiving VA benefits than ever before. VA's mission is to provide every veteran with the benefits that they have earned for their service to our nation, and we will never settle for anything less, VA Press Secretary Terrence Hayes said in the emailed statement. Whenever a veteran applies for benefits, our goal is to provide them with the best experience possible and to do everything in our power to get to yes. Goes on to talk about compensation and pension exams being a key step for veterans filing disability benefits claims to help determine whether their disability is service connected and in what disability percentage they may be entitled to. So it goes on, and you guys can take a look at this. It talks about the 2019 VA Inspector General report that found that department staff was hampered in its ability to oversee exam contractors because of limitations within the Veterans Benefit Administration electronic exam management system, a lack of reliable data, and inadequate staffing. Another IG report in 22 found that deficiencies in the contractors left veterans at risk for incorrect claims decisions. A 2021 Government Accountability Office report also found that VBA had trouble processing benefit claims for TBI, military sexual trauma, and Gulf War illness, in part because of problems with exams done by contractors. VBA claims processors returned exam reports for veterans with those three conditions to examiners for correction or clarification, about twice the rate of exam reports overall. So, wrapping up, in her letter, she pointed out watchdog reports as well as the concerns she said were voiced to her by constituents as she demanded to know the eligibility requirements for contractors, how the quality of service is measured, the average wait times for contracted exams, and how appeals after contracted exams compared to appeals after exams by VA doctors, among other questions. In addition to the odd location of exams and cavalier attitudes of examiners, Warren said constituents have told her that contracted exams take 30 to 45 days longer to complete compared to about 10 days for exams conducted by VA doctors. Veterans have also told her that they've had to travel multiple locations over several days to complete the contracted exams. Additionally, my office has heard numerous heartbreaking reports from veterans who describe the financial hardship and emotional pain and stress that they endured when they experienced a denial or a slow-moving appeal in cases where their exam was inadequate. Whoa. These veterans would have been spared such hardship if the contracted exam was conducted correctly the first time. Okay, I'm going to jump off this screen share and I'm going to give my 2 cents about this. Leah B's 2 cents. So it's super frustrating because for every veteran that goes and has a bad CMP exam or has a bad inadequate exam because of a lack of training or a lack of whatever, so many of them will appeal, but think of how many will just quit because they're frustrated. They don't understand the system. They just don't get it. It's confusing. It's overwhelming. And then on top of this happens. All right. What I will say is that there are a lot of great VA CMP examiners out there. Okay. There are a lot of really good ones that love veterans, that are veterans, that do care. So it's like any other industry, y'all. It's like any other business industry. You've got good apples and you've got bad apples. So they do get a lot of hate. There are some really cruddy ones out there, but there are some that just love veterans and want to do everything they can to help veterans. I was one of them. You still have to do things ethically and with what's in the reports. but not all of them are terrible. So take a deep breath. I've said this time and time again. When I had veterans come and see me for CMP exams, they were so nervous, and I would just try to break the ice. And I would say, you know, I'm a veteran too. Just relax. I'm here to help you. I'm here to listen to you, to understand. I totally get that not everybody gets that, but just try to calm your nerves. Work with a legal professional if you have a bad outcome, or if you don't think you're getting a fair shake. There are resources and recourse, and don't give up. Okay. So I hope this was helpful to some of you guys. Go check out that article and know that there are advocates out there. There are legal advocates out there that are listening and hearing you and trying to improve the system. Thank you for watching, and please drop some comments. All right. See ya.